Okay, welcome everybody. Thank you for joining us today to talk about arthritis. We have with us Gail Diedrick from United Healthcare. She is our nurse liaison and is always available to assist you. Today we're talking about arthritis and Gail is going to present, and then after she is done, we'll take questions, and also I will be introducing to you a new site that is available to all of our employees. And so I'm excited to talk about that. Go ahead and press your little hand button if you or somebody close to you is suffering with arthritis, just so we get an idea of what the interest is today. All right, good. A lot of people. Good in the sense that we're going to be able to get you the information that you need to help you or help someone you know. So arthritis is one of those things that we don't talk too much about or very often, but a lot of people suffer from it and a lot of our employees suffer. So we wanted to make sure that we get this information to you. So thank you for sharing that. I'm going to go ahead and share my screen and get Gail's presentation up. Well, Gail, if you would like to introduce yourself.
Sure. And good morning, everyone. My name is Gail Diedrick, and I am a health engagement nurse with United Healthcare. And I would like to thank you all for joining this call and, sharing this presentation on arthritis with your employees.
I'm guessing can you see my screen?
Yes, it's coming up.
Oh, you know what? Let me switch screens. Hold on one second. It's the PowerPoint.
And I see a lot of familiar names on the call.
Very good. Okay.
Yep. And good morning. Good morning, everyone. Thank you for joining this call on arthritis. And like I said, my name is Gail Diedrick. I'm a health engagement nurse with United Healthcare, and I work with the members here at the school district. You can reach out to me anytime for questions. And today we are going to talk about a very important topic, arthritis. I'm sure we all know someone who is suffering from or have suffered from arthritis. And in the United States, arthritis is one of the most common cause of disability, according to the CDC, and is often such a struggle for people with arthritis to manage their health condition and not let it interfere with work. And although treatment options have improved and symptoms of pain and stiffness are often intermittent, this chronic condition can result in missed meetings, late starts, or even unproductivity days, right? Simple things as just buttoning a shirt or opening the doors. Those can be challenging tasks for your employees and for your colleagues. So, without workplace support, a diagnosis of arthritis can even end up forcing people out of a job. And many accommodations can help workers with arthritis, and they can be inexpensive and readily available. So, even though there's no cure for arthritis at this time, I think with early diagnosis and control of the disease, we can help manage or reduce damage to our joints. And most people with arthritis can lead active and productive lives with the help of just the right medication, exercise, rest, and joint protection techniques. So, without further ado, we'll get into our presentation. And move right into the presentation, and we're going to define arthritis. I'm sure we've all heard the term arthritis, and arthritis simply means inflammation or swelling of one or more joints. It describes more than 100 conditions that affect the joints, tissues around the joint, and like other connective tissues. So, specific symptoms vary depending on the type of arthritis, but usually include joint pain and stiffness. Those are the classical signs. Moving into the next slide. So, general arthritis facts. So, there are more than 100 different types of arthritis, and specific symptoms vary depending on the type of arthritis, but usually include joint pain and stiffness. Those are the two classical signs that your physician will help to use to diagnose your condition. Osteoarthritis is the most common form of arthritis, and it occurs most frequently in the hands, the hips, and the knees. And experts don't know the causes of many forms of the arthritis. They just know that certain risk factors make it more likely that you will develop arthritis. Some arthritis statistics, an estimated 58.5 million US adults have arthritis, and experts believe that this number will grow as our nation's population gets older. Arthritis is the leading cause of work disability among US adults. And as of 2015, an estimated 23.7 million adults are limited in their usual activities because of arthritis. And we've all known someone who have suffered, lost their jobs, lost their job, unable to work, unable to function, take care of their families, just do their daily chores and activities because of this condition. And I'm telling you, the number of people who will be diagnosed with arthritis is going to grow by the time we get to 2040. I believe the CDC estimated at least 34 million. So arthritis is common among people with other chronic conditions, including obesity, diabetes, and heart disease. Moving into the next slide. We're going to talk about some risk factors. Some behaviors and characteristics called risk factors increases an adult's likelihood of getting some type of arthritis, right? Or making it worse. So you can control some of the risk factors and others you just cannot control. You can decrease your risk of getting arthritis or just making arthritis worse by changing the risk factors you can control. And the risk factors that you control are called modifiable risk factors. And these risk factors are just making simple lifestyle changes that can help minimize the condition. So some of the modifiable risk factors that we can change, as we'll talk about one in specific, overweight and obesity. So people who are overweight or obese are more likely to get knee osteoarthritis than people who are not overweight. And it's just because the excess weight can also make the knee osteoarthritis worse. So extra weight puts more stress on your joints, particularly weight-bearing joints like the hips and the knees. So what you can do, you can maintain a healthy weight by trying to eat healthy. Physical activity can help you lose weight and stay at a healthy weight. And you should always talk to your physician before you do any sort of exercise. Make sure you talk to your physician before starting any form of exercise, especially if you're diagnosed with osteoarthritis. You can learn more how to eat healthy and how to do safe exercises with arthritis if you go on to the myuhc.com page, click on the Rally Wellness, and you can actually view some of the exercises there. Infection, we're going to talk about infection. So infection, many microbial agents like bacteria and viruses can infect joints and potentially cause the development of some types of arthritis. So what you can do for that is you can see your doctor right away if you feel like your joints are swollen or if they feel warm, if they feel red. Just know that warmth and redness are signs of infection. So as soon as you feel that, like around your joints, make sure you reach out to your provider. Joint injury or overuse, such as knee bending and repetitive stress, can damage a joint and contribute to the development of osteoarthritis in that joint. So what you can do to protect your joints, I am sure you are all familiar and you have all gone through it. Just, damaging, your knee can be very painful. It can be painful walking up and down the stairs. It can be painful just doing your daily chores. You need to protect your joints by doing special exercises for the joints. You can also visit the Osteoarthritis Action Alliance. There's a website that is, I believe it's called Osteoarthritis Action Alliance, that you can visit for exercises to prevent knee injuries and external injuries to your joints. So occupations that involve repetitive knee bending and squatting are also associated with osteoarthritis of the knee, right? I see it among the teachers all the time. They're bending, they're squatting to help the students. They're bending, squatting to even assist the students with simple tasks, helping them with their work, helping them with activities, just taking care of the kids, just moving around in the hallways and moving boxes, moving supplies. Occupations and repetitive knee bending and squatting are definitely associated with osteoarthritis among our bus drivers, going up and down the stairs and just sitting in that position and driving and not using the joints as much. And then the extra weight on the joints can also affect or joints, right? Smoking is the number one risk factor, and smoking definitely is one of the biggest modifiable risk factors. So cigarette smoking increases a person's risk of developing rheumatoid arthritis. You'll see it referred to in the presentation as RA, and it can make the disease worse. So it can also cause other medical problems, right? So smoking can also make it more difficult to stay physically active when it is important. It's an important part of managing rheumatoid arthritis and other types of arthritis, and it has a big effect on arthritis because it affects the vascular system and affects the arteries. So what you can do, stop smoking. As simple as that. Just stop smoking. Get help by visiting I'm Ready to Quit on the CDC's website to get more tips. Reach out to myself, reach out to Carly, log on to the myuhc.com, and there's plenty of information there. Some non-modifiable risk factors we'll discuss quickly are risk factors that you have no control over. You can't control your age, right? Your risk for your age will place you at risk for most types of arthritis. As we all know, arthritis increases with age. Gender is another non-modifiable risk factor that we cannot control. Most types of arthritis are more common in women, including the osteoarthritis, the rheumatoid arthritis, and also the fibromyalgia, right? Gout is more common in men, and experts don't know exactly why women are at a higher risk for developing most type of arthritis, or why men are at a higher risk of developing gout. And alcohol has a lot to do with the flare-up of gouts. I'm not saying that, that's the reason why, but typically that's what we see as clinicians. Genetics and inherited traits, people born with specific genes are more likely to develop certain types of arthritis, right? So such as the rheumatoid arthritis, the systemic lupus arthritis, and also genes that are called HLA, which is also known as human leukocyte antigen class 2 genotypes. These genes can also make your arthritis worse. Experts do not know why people with these genes are at a higher risk for developing arthritis, or why it makes their arthritis worse, but these types of genetics traits, inherited traits, definitely increases your risk for osteoarthritis and rheumatoid arthritis. Moving into the next slide, we're going to take a look at how do you know that you have arthritis? Okay, we all have aches and pains. So how do you know if your joint symptoms means that you have arthritis? Only a healthcare professional can tell you for sure, but certain signs usually point to arthritis. And there are 4 important warning signs that should prompt you to talk to your healthcare provider. And we spoke about the pain, right? The pain from arthritis can be constant, or it may come and go. It may occur when at rest or while moving. Pain may be one part of the body, it may be at one part of the body, or it may be at different parts of the body. It may be from one extremity to the next extremity. It could be in the neck and it could be in the ankle. Swelling. Swelling, some types of arthritis cause the skin over the affected joints to become red and swollen, feeling warm to the touch. So swelling that lasts for 3 days or longer, or occurs more than 3 times a month, should prompt you to visit your doctor. Know that pain is not normal. Pain is the signal your body telling you that something is wrong. And also swelling. Stiffness. Stiffness is a classical arthritis symptom, especially when you wake up in the morning, or you're about to sit at your desk, or if you're riding a car for like a long time and then you stand. If you get that stiffness, that is a classical sign of arthritis. Morning stiffness that lasts longer than 1 hour is a good reason to suspect arthritis. Difficulty moving a joint. So it shouldn't be that hard or painful to get up, or to get out of your get up, or even get out of your favorite chair, right? If you're having difficulty moving that joint, that's also a classical sign. What do you do? All right, so your experience with these symptoms will help your doctor pinpoint or pin down the specific type of arthritis. So before visiting your doctor, you need to keep track of your symptoms for a few weeks, not 1 or 2 days, right? Because sometimes when we overdo it, we do our chores, we do extra activities at work, we get aches and pains, right? So make sure you track your symptoms for a few weeks, noting what is swollen and stiff, when, for how long, and what helps ease the symptoms. Be sure to note other types of symptoms, even if they seem unrelated, such as fatigue or even a rash. So if you have a fever along with these symptoms, you may need to seek immediate medical attention, because that's a sign of infection, right? So if your doctor suspects arthritis, they will perform physical tests to check the range of motion in your joints. They'll probably ask you to move the joints back and forth. The doctor may also check passive range of motion by moving the joint for you. Passive means that the doctor will move that joint for you. Any pain during a range of motion test is a possible symptom of arthritis. And your doctor will ask you about your medical history and may order lab tests as needed. So most people start with their primary care physician, but it is possible to be referred to doctors who specialize in treating arthritis and related conditions. Getting an accurate diagnosis is an important step to getting timely medical care for that condition. Moving into the next slide, we're going to talk about musculoskeletal health, or more commonly known as your bones, muscles, and joints. So as we age, our muscles shrink and or grip decreases, and loss of muscle strength and flexibility may cause you to become less coordinated or have trouble balancing. Osteoarthritis is the most common form, like I said, it's the most common form of arthritis. It occurs in older people as a result of long years of wear and tear. So over time, history starts to take its toll on your joints, right? Which is the place where 2 or more bones meet. So anywhere where 2 or more bones meet, those are called joints. So if you get pain, stiffness, and inflammation in the joints, that is a classical sign of osteoarthritis. Like I said, I'm reiterating, maintaining a healthy weight can help ease some of the effect on your bones, muscles, and joints. You could also maintain regular exercise regimen that includes stretching and weight-bearing exercises such as non-weight bearing exercises, I should say, such as walking, jogging, or tennis. This may help your bones get stronger and slow bone loss. So your exercise routine does not need to be strenuous or any at all, hard on your bones. It is just simple exercises that you can do that adds up and will help strengthen your bones. Moving into the next slide, I'm going to talk a little bit about osteoarthritis because it also is one of the most common ones. Osteoarthritis, also known as OA, is a common joint disease that most often affects middle-aged to elderly people. So it is commonly referred to as wear and tear of the joints. You'll hear your providers, you'll hear your colleagues refer to, they've been diagnosed with the wear and tear arthritis. That's the osteoarthritis of the joints. But we now know that osteoarthritis is a disease of the entire joint involving the cartilage, the joint lining, ligaments, and the bones. So although it is more common in older people, it is not really accurate to say that the joints are just wearing out, right? It is characterized by breakdown of the cartilage. That is the tissue that cushions the ends of the bones between the joints. So bony changes of the joints, deterioration of tendons and the ligaments, and various degrees of inflammation of the joint lining, it is called the synovium. So you'll hear your physician refer to as your synovium fluid. So this arthritis tends to occur in the hand joints, the spine, the hips, the knees, and the great toes. That's your big toes, right? The lifetime risk of developing osteoarthritis of the knee is about 46%, and the lifetime risk of developing osteoarthritis of the hip is 25%. And that's according to the osteoarthritis product study that was done in Johnson County. Osteoarthritis is also one of the top cause of disability in the older people, and the goal of osteoarthritis treatment is to reduce the pain and improve function. There's no cure. It's just to reduce the pain and improve function. And there is no cure for the disease, but some treatments attempt to slow the disease progression. Moving to the next slide. So how is osteoarthritis diagnosed? So a doctor diagnoses osteoarthritis through a review of symptoms, physical examination, x-rays, and lab results, right? A rheumatologist, who is a doctor who specializes in arthritis and other related conditions, can help if there are any questions about the diagnosis. So you might be referred to a rheumatologist. How is the osteoarthritis treated? There is no cure for osteoarthritis, so doctors usually treat the symptoms, right, with a combination of therapies, which may include, but not limited to, increase in physical activity, physical therapy with muscle strengthening exercises, weight loss for sure, some medications, including over-the-counter pain relievers and prescription medications to control the pain and the swelling, the inflammation, and sometimes infection, supportive devices such as crutches or canes. Sometimes surgery is even necessary if other treatment options have not been effective. And in addition to these treatments, people can gain confidence in managing their osteoarthritis with self-managing strategies, and we'll talk a little bit about that at the end. And these strategies can help reduce the pain, disability, so people with osteoarthritis can pursue the activities that are important to them, because that is important. Because if you can't pursue your activities and you're suffering from pain and swelling and immobility, then that can also lead to depression, which is another topic, right? So some people are concerned that physical activity will make their arthritis worse, but joint-friendly physical activity can actually improve arthritis pain, function, and quality of life. So when I get the calls from members, they always tell me, oh, but you don't understand, I'm in pain, I can't do it. That's why you need to do it. You need to push yourself, you need to do it, because that is the only way that you can relieve the symptoms and actually build up your bone strength and actually improve function is by doing the exercises. So let's move into the next slide. So as you see here on the screen, there's a delay in my screen, Carly. All right, so as you see here on the screen, you will see a picture of the osteoarthritis of the hand, and you will see on the right a picture of osteoarthritis of the bone, the knee. You see that. So pain worsens at the end of the day. Classical signs, the joint stiffness, especially after inactivity. The crepitus. The crepitus is the clicking. You will hear it clicks. So when you move your joint, or let's say you move your elbow, you'll hear like cricking. It's like sand. It's grinding. You'll hear people will say that the joint is grinding. That's called crepitus. Restricted activity, and definitely painful and chronic, right? Moving into the next slide. Okay, so rheumatoid arthritis, that's another form, form of arthritis that we're too familiar with, right? I'm sure we've known many people throughout the district who are suffering from rheumatoid arthritis, and that causes joint inflammation and pain. It happens when the immune system, this is a little bit different, this is when the immune system doesn't work properly and attacks the lining of the joints called the synovium. So the disease commonly affects the hands, the knees, the ankles, and usually the same joint on both sides of the body, such as both hands. So you'll see it in both hands and you'll see it in both knees. But sometimes the rheumatoid arthritis causes problems in other parts of the body as well, such as the eyes, the heart, and the circulatory system, and also the lungs. Okay, remember, it affects the it happens when the immune system doesn't work properly and attacks the lining of the joints. So for unknown reasons, more women than men get rheumatoid arthritis, and it usually develops in middle age. Having a family member with rheumatoid arthritis increases the odds of developing rheumatoid arthritis significantly. So moving into the next slide. Okay, so you'll see pain worsens at the start of the day, joint stiffness for 1 hour in the morning, restricted activity. You see the symmetrical polyarthritis. Next slide, Carly. It affects the hips, joints, shoulders, and here's a picture. This is typically what it looks like in the hands. Painful, right? And you'll see the pain worsens at the start of the day, stiffness for more than 1 hour in the morning. You have restricted activity. It's very painful. Symmetrical, you see the symmetrical polyarthritis happening in both hands, small joints of the hands, and it happens in other joints such as the hip, the knee, and the shoulders. And it actually makes the joints look deformed, right? Next slide. And you'll see the synovial inflammation on this slide, the extra articular features. and the rheumatoid nodules are pathogenic. See that? Okay, next slide. All right, so there are 5 ways, quickly, there are 5 ways to manage the arthritis. And if you use these self-management skills, it will definitely help you manage your arthritis. So join a self-management education workshop. The workshops are on the Arthritis Foundation site. You can visit that and you can learn the different self-management education techniques workshop. Join the workshops, they're free. The CDC, there's one on the CDC which can help you learn skills to manage your arthritis and make good decisions about your health. So how can a self-management education workshop help you? You're probably saying, okay, well, how is that going to help me? Well, learning different strategies to better manage your arthritis can definitely help you feel more in control of your health, manage pain and other symptoms. You can carry out your daily activities, which is very painful and sometimes just unrealistic with the inflammation, like going to work and spending time with loved ones. If you reduce the pain, reduce the inflammation, you can do all these things, reduce stress. It can definitely improve your mood, communicate better with your healthcare provider about your care, and they will also work with you on the 5 strategies to manage your arthritis at any age. Another strategy is to be active, right? So physical activity is a simple and effective non-drug way, okay, to relieve arthritis pain. That is, you're probably saying, oh, but if I have pain, I can't work. You have to push yourself. You have to work through it. Physical activity is just one of the simple, effective, non-drug way to relieve arthritis pain. So being active can reduce the pain. It improves function, mood, quality of life for adults with arthritis, and regular physical activity can also reduce your risk of developing other chronic diseases such as the heart disease and the diabetes. It can help you manage these conditions if you have them already. So it's like a double whammy, right? So being active, it will also help you lose the weight and it will reduce the stress on the joints. So stay active as your health allows, right? And change your activity level depending on your arthritis symptoms. So some physical activity is better than none, right? So the physical activity guidelines for Americans, it is recommended that you do at least 150 minutes of moderate intensity exercises per week. And you can also visit the HealthGov website to learn more about the physical activity guidelines for just staying healthy and just what is recommended, the recommended exercises that you can do to help with the osteoarthritis. You can also talk to your doctor. Your doctor will either recommend you to physical therapy. Your doctor can help guide you and lead you to the different resources that can help you manage the arthritis or help you to improve your health so you can exercise. Talk to your doctor if you have joint pain and other arthritis symptoms. It's important to get an accurate diagnosis as soon as possible so you can start treatment and work to minimize symptoms and prevent the disease from getting worse, because these conditions, they actually get worse. So it is important, the earlier you're diagnosed, the earlier you can start the treatment, right? So the focus on the arthritis treatment is to reduce the pain, minimize joint damage, improve or maintain function and quality of life. You can play an active role in controlling your arthritis by attending regular appointments with your healthcare provider and following your recommended treatment plan. And this is especially important if you also have other conditions. Like I'm going to reiterate, I'm going to say it over and over again, like diabetes and like heart disease. Manage your weight, losing exercise, losing exercise, losing excess weight and staying healthy. is one of the simple ways that you can manage your weight, right? This is particularly important for people with arthritis. So people who are overweight or obese, losing weight and reducing stress on the joints, particularly weight-bearing joints like the hips and the knees, will definitely help maintain reduce your symptoms, right? In fact, losing as little as 10, just 10 to 12 pounds can improve pain and function for people with arthritis. And we've heard about the numbers, the same with blood pressure. If you lose 5 pounds, it can help with your blood pressure. Same with diabetes. Well, losing as little as 10 to 12, just 10 to 12 pounds can improve pain and function for people with arthritis. At any age, low impact, arthritis friendly physical activity like walking and dietary changes can help you lose weight. Protect your joints, right? So joint injuries can cause or worsen arthritis. So choose activities that are easy on the joints, like walking, like riding your bike, and also swimming. These low impact activities have a low risk of injury and do not twist or put too much stress on your joints. You can learn more about how to exercise safely with arthritis on the Arthritis Foundation page and on the CDC website. There's lots of information out there. Sports or work-related injuries to joints can increase the likelihood of developing osteoarthritis. So you definitely want to reduce the likelihood of developing or worsening osteoarthritis. Just taking steps to minimize or prevent injuries to the joints, such as, like wearing your protective shoes. You can sometimes wear even a brace. I wear a brace usually if I'm going to do like strenuous, if I'm gonna have like a day where I'm gonna be running multiple chores, I actually put my ankle brace on or my knee brace on. Or if you're gonna ride your bicycle, you can use those supportive devices to actually protect your joints. Sports or work-related injuries to the joints can definitely increase the likelihood of developing osteoarthritis. So you definitely don't want to make the situation like worst. So the next slide will definitely share different resources. If you go out to the myuhc.com page and you click on health and wellness and you click on rally, there are different missions that can help you with your mood, with losing weight, with exercising, joint pain. We also have disease management programs. We have coaching programs. You will also have several mobile apps that can help you. I spoke about Rally. If you are pregnant, that will cause extra strenuous weight on your joints. So we do have a maternity support program that you can refer to that will help you manage your arthritis and also help you with your maternity journey, both antepartum and postpartum. We have our United Health Allies. We have several resources. I know the district, they have several resources. Carly and Charlotte, they have vendors who they have partnered with too that will help support you. So with that being said, I'm just going to stop for a few and take some questions and just to find out if there's anyone who might need more additional information or have any questions at this point. So basically, we all know that arthritis is chronic. It is a progressive disease. It is definitely one of those disorders that we can control. We have to manage it. We have to live with it. So the best way to control it is through early diagnosis, work with your provider, and we want to minimize more joint pain and actually relieve the swelling and the pain. Any questions at this point? Is there any questions in the chat?
There are not. That's a great visual. I think that 10 to 12 pounds, I think that's, helpful. We talk about that with diabetes. We talk about that
Yes.
um, with high blood pressure. So I think that is a great visual for people.
Right. So it's like
There's hope to
Wami.
relieve pain.
ex- Exactly. So not only are you losing the weight to relieve the joints, it also will help with your blood pressure, will also help with your diabetes, your blood glucose levels.
Absolutely. Yelena, you have a question?
Yes, I have a question. But if I turn on my camera, I lose my speaker, so I'm sorry.
It's okay.
um, I have a question about like arthritis and the effect on the spine, and then
Hmm.
also, vitamins that would be helpful.
For for osteoarthritis, so I am going to tell you that you should speak to your provider when it comes to vitamins. There are several vitamins that will help with your bones. I know there's one that there's one called Mobility. I am not here to promote uh, uh, vitamins, I should say, but we do have the omega vitamins that are very good for your joints, and there's also one called glucosamine. I believe it's glucosamine. Um, there's one called MoveMD. There's several medications that are out there that will help with your joint pain and with just reducing the stiffness and swelling in your joints. You should speak to your provider. I don't really want to get into the vitamins or any in particular. One that I do recommend that I take myself is the vitamin D. So it I are you familiar? Do you take vitamin D?
Yes, I've been taking vitamin D every day. That helps. I always
Right. So
notice that does help.
yeah, so people who are deficient in vitamin D are at increased risk for osteoporosis. So I vitamin D supplement, how much do you really need? That all depends on your physician. I would say talk to your physician. You can take a one tablet. They come in different doses. You have a 25 and you also have I believe you have different doses. There's a 25 one, but I do know that vitamin D is one of the vitamins that definitely, if you're lacking vitamin D, you're at risk for osteoarthritis. So that one I would recommend. The others, I would say you speak to your provider regarding that.
And I think in addition to vitamins, I think what's helpful when it comes to arthritis is certain foods that may aggravate arthritis, right? And certain exercises to avoid to not induce pain and make it worse. So those are two things to think about. And the website that I'm going to show you in a minute can help. And we also have our dietitian here at our doc clinic
Hmm.
that is available to
Nicole?
talk to you. So if you have never talked to a dietitian about, the proper diet or things to avoid with arthritis, wouldn't you agree, Gail? I think that would be an important thing to do.
Yes, definitely. And they'll tell, yeah, and if you haven't discuss this already with your provider. There are certain herbs, right? And we've heard about herbs, and there's a whole theory or a whole myth on herbs, and some will tell you it's good for you, some will tell you it's not good for you. Have you heard of turmeric? I forgot who asked that call. Who asked
Yelena.
that question? Yeah. So turmeric is one of it's anti-inflammatory for one, and it definitely helps with pain relieving. It has pain relieving effects. I know ginger, I tell you all the time on the calls that I use ginger. Ginger is also an anti-inflammatory. It's not only good for the gut, but it's also an anti-inflammatory. So it's good on the joints, right? And then you have the fish oils. And the fish oils, they will when we talk about fish oils, we think more about cardiovascular or eyes or heart, but believe it or not, the omega-3 fatty acids actually helps with rheumatoid arthritis. Um, I know, like I said, the glucosamine is also good. Um, and there are so many other herbs that you can use that I can't even. There's also avocado soybean. I don't know if you've ever heard of the avocado soybean. It's an extract from avocado and soybeans. So it's kind of like an oil, and they say that it prevents the breakage of the cartilage. So it also helps with joint pains. There's several out there, but can I tell you, speak to your doctor before you take any of them. There's also the devil's claw that they speak about. There are numerous vitamins, supplements, and herbs that are out there that will help with osteoarthritis and also help with bone and cartilage
Okay,
growth.
excellent.
Yeah. But always speak to your provider before you take any of these, because like everything else, if you have other underlying conditions, some of these herbs and medications can also exacerbate your condition. So always speak to your provider before taking any supplements or any herbs.
Okay, great. So the resources, there's so many resources that are available that you may not have taken advantage of before. Again, Gail is an excellent resource. If you are on our medical plan, you can reach out to her. Charlotte, if you want to put her contact information in the chat box. You also have the United Healthcare website if you are on the medical plan as well. But lastly, we have this website that has been made available to us through the Arthritis Foundation, and they have made a separate portal just for our school district. And this is available to all employees, regardless of your insurance plan, because it doesn't go through the insurance. It's just a resource website. So our substitutes can use it, our retirees, employees, regardless of full-time, part-time, and insurance plans. So this is a great resource that I'm very excited to share with you. Or if you're living with somebody who is suffering from arthritis, you can get onto the website with them and take a look at the resources. So I want to go ahead and quickly and show you the website. Does everybody see the screen?
Yes.
Yes.
All right, thank you. So this is our website. It's called Arthritis at Work, and you're going to have access to the link. This is the flyer that we have. We're going to be sharing it with the Wellness Champions. I will also put it in the chat box for you to take advantage of.
How do they access this link, Carly?
So the flyer is going to go out. We're going to be promoting this, starting
Okay.
in November. The link will be posted on this flyer, and we'll also have it on the hub. So we're going to do kind of like a slow rollout for this, but you are the first to hear about this in the district. But we will make the link available, and it's obviously very easy to memorize. arthritis.org/PBCS is what they created for us. So what you'll see here is that there are so many resources. And I don't believe you have to necessarily log in, but I'm going to show you something that you're going to take advantage of if you want to benefit more. But you can see it talks about sleep, eating, pain management, physical activity, find some exercises you can do, and stress management. Okay, and some other items down here as well. So there are a lot of resources on this website that are available to us, and there is also an app. And with the app, it allows you to tell, once you're logged on, it allows you to kind of rate how you're feeling. And so if you're feeling pain, it'll give you suggestions and give you feedback. So it's really a great resource as well as an ebook. Are there any questions so far on this website?
And the app is free, correct?
The app is free. So everything is free and available to all of us. It was free to us as well. It's through a grant that was made available to us, and it was promoted to all of the school districts nationally, as well as probably some other nonprofits.
Okay. Perfect.
This is available to us. So what I'd like to do, I'm going to show you in a second. I have an arthritis help book that I have here, and I want to give it away to somebody, one of our employees, any of you who have attended today, and anyone who watches the recording that could really benefit from this website and from the information. So what I'd like you to do, if you want to get of course, I want you to log on to this website. I want you to, play around, download the ebook, take the survey, download the app, whatever it is that, all of the above that you think would help you and benefit you. But if you, by October 31st, if you do at least one of these, either download the ebook, download the app, or take the pain survey, then we will put you in a raffle for this book. And I will show you the book. Can you see it?
Yes.
In place of my face. Okay, so this is a great resource. It has exercises in it. It talks about nutrition. It talks about just how to live better with arthritis. So this is a great resource that I have here, and I want to be able to give it to somebody who could benefit from it. So if you are someone who could benefit from the arthritis help book, go ahead and take advantage of at least one of these resources, and then just send me an email that you've done it, maybe a screenshot of something that you've done, and then I'll put you in the raffle for this book. Okay, but most importantly is that if you feel you could benefit from this website, that you go on and you take the survey, the app, if you like the apps, whatever it is that you feel would help you, and you start taking advantage of the resources that are available here to you. Also reach out, as I mentioned before, to Gail if you feel that would be, that she can help you. Your doctor as well, if you haven't seen your doctor. I'm going to share the website in just a second. I'm going to share the flyer. Reaching out to your doctor if you haven't spoken to your doctor about pain that you're feeling, this is a good time to do that. Reach out to Gail. Reach out to our dietitian at the district on-site clinic. She can do virtual appointments. The doc is available to all who are on the medical plan. If you are not, this is really important too. If you are not on the medical plan and you want to talk to a dietitian, we actually will have, throughout the year, we have our dietitian students from Kaiser University who are with us. And we actually have one that is going to be available beginning next week through, right through before the Thanksgiving break. So if you don't have the insurance, so you therefore could not benefit from the dietitian at the doc clinic, then you are welcome to make an appointment with our student, virtual appointment, and she can talk to you about ways to help arthritis through our diet. I'm going to go ahead and share this flyer with you. Are there any questions?
So someone wanted to know if the site is available now or in November.
It's available right now.
Okay.
Just launched this week. So you can go ahead on and take advantage of that. And again, if you send us some kind of screenshot that you've done something interactive on the website, whether it's the survey, downloaded the app, or opened the ebook by October 31st, then we will put you in the raffle for this book.
Okay. Thank you.
Yelena?
Yelena had a question.
Yeah, I have a question. To see the dietitian at the doc, is that going to be the $10 copayment? Is that what it is?
No, that is at no cost.
Free.
And you
Okay,
can
so
see her as many times as you need.
Okay, and to make an appointment, how do you schedule that?
You would go onto the website. I will put the website in our chat box, and hopefully you know that our provider for the doc has changed. It is no longer CareATC. Now it's called Marathon. But the good news is that the dietitian that was with CareATC is the same one that was hired on by Marathon. So if you've met Nicole before and want to see her again, then you can do that. And she's a great resource. But yes, no cost for the dietetic services. There's a link to more information about that clinic. Great question. Thank you, Yelena. All right, let's do another show of hands. Go ahead and press your little hand button if you think that you would take advantage of this arthritis website for you and or someone close to you. And also, if you have a coworker, somebody somebody you work with or somebody that you know works in the district that is suffering from arthritis, be sure to share this great resource with them. Again, it's open to all employees, substitutes, retirees, everyone who is associated with our school district. All right, great. Thank you for attending today.